So, okay. Alexander is the co-chair of the Joint Steering Committee, and there's 5 of us. Maybe we let Dina to just walk us through how we, the 5 of us, has contribute to the scene on the Joint Steering Committee. Dina, I flipped the slide for you.
Okay, I prepared some slides at the end of my presentation. So if you want me to share my screen, maybe.
Hey, you
want me to use this?
You can use yours. Yeah, I make you a co-host.
Okay, just a second.
You share your screen now. I make you a co-host.
Just a second, please.
So after that, we'll move on to the presentations.
Well, the IFKF is part of the World Kidney Day Joint Steering Committee with the ISN. And as SF have mentioned, that we are 5 members from the IFKF and from the ISN. And for the World Kidney Day, the 2023, which was under the theme of Kidney Health for All, the preparedness for the unexpected in supporting the vulnerable, we participated, all of us, all the Joint Steering Committee, we participated in this editorial that was published in the Kidney International the end of last year under the name of the theme of the World Kidney Day. Also, we participated in a podcast that was provided by the ISM before the World Kidney Day, and I participated myself with Lily Fioma and Dr. Ali Abu Alfa from Lebanon, and he's the chair of the ISN Renal Disaster Preparedness Working Group. And it was a very interesting and podcast. This was followed by webinar on the day of the World Kidney Day, and this webinar we had 4 speakers, and Latha and Agnes Fogo from the ISN were the presidents of the meeting, and SF and Ifioma Wilasi from Nigeria were the moderators of this session or this webinar. We had 4 speakers, 2 from the patient perspective and 2 from the doctor's perspective. Myself was the nephrologist perspective, and Adrian Liu was from the health system perspective. And Agnes and Latha had a welcome note in the beginning, and then we had a morning session, and that was repeated at night for a night session for the time differences around the world. Also, we participated in the WCA 2023 in Bangkok, and I participated with as a speaker in this session, and SF was a chair for this session, and this is my mother. And we hope that in 2024, we also contribute strongly, and we have our participation in the World Kidney Day 2024. Thank you.
Okay. So can we have the first presentation from you then? We don't have to switch over then. Dina,
sorry?
Dina, do you want to do a first presentation? Dina? Are you still here?
I think Dina's got frozen for the time being. Maybe there's a connection.
Sorry. Yeah.
Dina, would you like to make your presentation first?
Okay. So I will go quickly through our activities in Egypt. Now you can see my screen, right?
Yes, we can.
Oh, yes.
Okay. So the World Kidney Day in Egypt is organized under the National Kidney Foundation of Egypt, which is under the umbrella of the Egyptian Society of Nephrology. And this is the list of the presidents of the kidney foundations since it's initiated in 2000, I think 2006, with the first president was Professor Adel Afifi. And I've been the moderator of the World Kidney Day since then. So all through our activities, we start by educating the educators, and we have sessions that's directed to the nephrologists to show them the value and the importance and their commitment towards their societies and their communities, that they have to educate the community and they have to educate their patients about the World Kidney Day and about the chronic kidney disease. We started in 2007 and when starting big celebrations in 2008. And we started by arranging kidney walkathon every year that was participated by many of the Egyptian Society of Nephrology nephrologists, and it was announced before, and we had many attendees at that time. We've been always supported by the medical students from all over Egypt through the International Federation of the Medical Student Association, and they always help and support us in giving the information to the public. We just give them the material and we give them the message, and they start talking to the people and inviting them to the event, and we inviting them to our screening. And since our beginning, we're always collaborating with the Ministry of Health and Population in Egypt, and they always provide us with those screening cars that are always moving with us wherever we go. And as you see, many people are seeking for screening. We do public seminars everywhere for the World Kidney Day, and we go to the universities and we enjoy the creativity of the medical students in those events. And we go to the less privileged villages, and always we had the media coverage for all the activities that we have. We target the young and we stress on the value of sports and of healthy lifestyle, and also we go and we communicate with the children, and we invite children and give them just simple messages about the importance of protecting their kidneys and about healthy lifestyle to protect the kidneys in the future. We communicate with all organizations, and this was from the Rotary with the His Excellency Mustafa Madbouli, who is currently the Prime Minister in Egypt. And in 2021, when there was no way of celebrating, we just had a webinar. And last year we had a marathon and a football match with the biggest football team in Egypt, which is Al Ahli team, and always with awareness session and a huge press conference that was covered by all the media channels in Egypt. And we also managed to light the fence of the Citadel in Cairo with the World Kidney Day logo. And we had a radio campaign that we recorded the messages ourselves, and it was aired. It was then spread on all the radio channels in Egypt. And all our activities were on the media and on television. And in 2023, we also continued, and we continued actually strongly with the messages that we are having, and we arranged a celebration in Cairo, and we arranged rowing race in the Nile for the World Kidney Day on the day next to the World Kidney Day on Friday. And it was a beautiful day. Everyone was wearing the t-shirts of the World Kidney Day. All the media and all the television was joining us to spread the message. And this was a race between the team in this club wearing the World Kidney Day logo and moving for a very long distance in the Nile in Cairo. Also on that day we had a public awareness day, and of course we had everything that's covered by the media. We had online, we had media coverage by television, by the Ministry of Health media office, who supported us by a huge media coverage from all of Egyptian channels. And also we had a strong contribution over Twitter, and this was also supported by the Ministry of Health and creating a hashtag of the World Kidney Day, but of course it's translated in Arabic. And this remained for many days, and all our activities, as you see, was aired, and they had interviews with many of us on that days on many channels. On that day, we promote for the 8 golden rules, of course, translated in our language. And this is given to all the attendees with the help of the medical students, as we mentioned before. And we have many materials and many printing materials and just some giveaways for the kidney, for the World Kidney Day, and of course some celebrations, some cookies, some cakes for the World Kidney Day. And this is example of some of the giveaways that we had. And our activities was also mentioned in the impact global activities of the ISN that was published after the World Kidney Day. And the rowing race on the Nile was shown as one of the best ideas for the World Kidney Day 2023. Thank you, and I think I have mentioned this next part, this second part before, so I'm done.
Thank you, Dina. SF, over to you. The next presentation. SF, we can't hear you.
Yeah, hello, Agnes, I'll make you co-host now. Can you come in?
Do you want me to continue?
Yes. You can show your slide, or do you want me to show your slide?
Okay, I try to share it.
While you're doing that, I quickly welcome Ayşe from Turkey. Thank you for joining us.
Okay. Can you see my slide? Oh no, it's not perfect.
Yes, we can.
Okay, so I just leave it here like that one. So in 2023, the Hungarian Society of Nephrology and the Hungarian Kidney Foundation were working together to make this day very famous in Hungary. And the activities we had were to, for example, to broadcast our activity. First of all, there was a press release about the aims of the World Kidney Day, and we felt very important that the stakeholders get acknowledged that kidney patients are a very vulnerable patient group. Also, leading nephrologists in Hungary provided radio interviews, and the main topics were the prevention and the early recognition of the CKD, just because in this case we can treat these patients much better. The next activity was to provide a quiz about the kidney health, and we distributed this squeezed by the social media. And we were interested what are the knowledge gaps people have. And in this regard, I don't only regard the kidney patients, but or people in the population, because we feel that the education of the patients are important. So we distributed materials about for the patients about the kidney diseases, how to detect, how to keep diet, how to take medications, etc. But we also provided presentation for people who don't have kidney disease or who are not aware of having kidney diseases, because it is very prevalent in the society. So we aimed to keep the attention of the senior citizens. And we spoke about the significance of the blood pressure and blood sugar and drinking enough fluid, etc. We also aimed to educate the family physicians, and this is important because there are only 200 nephrologists in Hungary, but more than 1 million people have CKD in our country. So it's very important that the family physicians support us, our medical activity. And also we aimed the pharmacies, because there are many over-the-counter drugs in the pharmacies which may be dangerous for the kidneys. And just to educate for the age groups, we also aimed to provide education for the small children in the schools, and young nephrologists were speaking about the importance of the kidneys and the kidney diseases. And after these presentations, we asked them to make some drawings, and you can see drawings from kids, which I think is very cute, and we were happy to get these results. Thank you for your attention.
Yeah, start young, kids are kids. Yeah. Okay, we move on to India. Who is Tanka presenting? Is that right? Yeah.
Vasanti.
Yeah, once again. I'll just share the screen.
Yeah. Okay. Make you co-host. You can use now. How about malaria? Malaria.
Yeah.
Okay.
Yeah. Hi, everybody. Thank you for giving me this opportunity. And this is Vasanti. Before going on to the topic, I would like to just give a small brief about Tanka. So Tanka Foundation was started 30 years ago by Dr. Georgie Abraham, Lata Kumaraswamy, and like-minded people with the aim of just reaching out to needy with kidney diseases. It is our vision to see the world that ensures healthcare and medical facilities for all. And our mission is to provide quality and affordable treatment to underprivileged people, to create awareness and to detect and prevent kidney diseases. Well, with over time, with the trust of people and support from our, good-willing people, we grew from providing providing financial support to 14 dialysis centers in about 30 years. And our dialysis centers are all spread around Tamil Nadu, mostly in Chennai, and a few of them outside Chennai. So far, since our inception till June 30, 2023, we have provided 5,80,906 dialysis. The number of dialysis units we have is 14, and the number of dialysis stations is 230. Number of patients in all our dialysis units is 850. So far, we have the patients benefited through us is 2,607. The number of dialysis per month we provide is 8,523, out of which 8,305 is absolutely free of cost. We have given financial support to a crore of 4 crores to tune of 4 crores, benefiting 5,000 patients. And awareness, as we all know, is very important. We have a special team for awareness, and our awareness team has conducted 1,355 programs, reaching out close to 2 lakh people. And screening camps, we have conducted 483 camps, reaching out close to 40,000 people. And this is a few of our dialysis centers. And now coming to the topic, World Kidney Day. This was absorbed with full enthusiasm and vigor by each and every staff of Tanker Foundation. They created a week ago, they started making preparations, they made charts, they had creative cutouts, they made rangoli, or that's a art in the form of kolam, that's we call in India. And they had many, many programs reaching many messages, many charts with messages of kidney care and how to safeguard your kidneys. On 9th, Thursday, 2023, our staff members pumped in even more energy into that day, giving out messages, reaching out to many more people. Now, we started early in the morning with the morning walkers. We distributed caps with messages of kidney care to all the beach walkers and discussing with them how to take care of their kidneys, spreading the messages as to what eating habits they should, healthy eating habits they should follow to protect and safeguard their kidneys. We had also had road shows that we reached out, we went to many schools and touched upon even kindergarten children who participated with full enthusiasm when we discussed to them about kidneys. And everybody participated in Show Your Kidneys challenge with the photographs. You can see the kids with showing their kidneys. And they participated they asked so many questions, and our team was ready to answer each and every one of them. And we had, we conducted awareness programs in schools and colleges in Madurai, Vellore, Tirupur, and in Chennai. So, and the highlight was, we conducted road shows also. The highlight was the ribbon building was lit with a message, to carry the message of World Kidney Day with the World Kidney Day colors. And the billboards in Chennai were carrying the 8 golden rules of World Kidney Day. So, and the last but not the least, we had road shows, and we had a celebrity flagging off a walkathon in collaboration with Mohan Mehta Hospital. And this received a lot of attention and media coverage as the celebrity was involved, and we could give out messages of World Kidney Day to many of them. And this also had a lot of media coverage in many newspapers. And our plan for 2024 is to have more awareness programs, especially in low-income areas. We would like to, have more screening camps. We would like to step up on the 2023 World Kidney Day activities. We plan to host more webinars, competitions and quizzes in schools regarding kidney health among children. Then walkathon, marathon, and cycle rally we would like to organize. And more than anything, we would like to influence the government on raising awareness on non-communicable diseases, especially CKD. These are some of our patients expressing their gratitude. Hands that serve are holier than the lips that pray is the motto that we follow, as Gandhiji says. And I would like to thank you for giving me this opportunity, and would like to join hands with all of you to make the forthcoming 2024 World Kidney Day a very meaningful one. Thank you for the opportunity. Bye-bye.
Thank you very much. Very good work. It's interesting. Make the kids know about what WWE is all about, isn't it? Start them young. Okay, so we move on to Samuel. Welcome, Samuel. I'm making you co-host now. Samuel.
Yeah, thank you very much for giving this opportunity to Malawi to share what actually we have actually done and how we have been working on that. I'm sure Kalusi will share this quickly. Is that possible?
So is Samuel's mic okay? We're not able to hear him properly.
I think now you can hear me proper now.
Samuel,
Are you
you're
hearing me now?
it's
Okay,
not very audible.
let's try again. Just try
Yes, are
again.
you there?
Maybe if you remove your headphones and talk into the
Hello, are you able
computer.
to hear me now?
We're not able to hear you. And it's
Can you
the
hear me now or you try to hello, are you able to hear now?
your voice is coming in and going. Is everybody able to hear, Samuel? I think it's just not clear.
You should.
Hello, are you able to hear now?
Maybe the connectivity is not very good, Samuel. Shall we just move on to women in maybe women in nephrology?
Yeah,
Halima, I'm making you the host now. We'll come back to Samuel later.
yes.
All right, thank you.
Okay,
Next.
Ina,
Halima.
okay.
That's okay. Good.
Can you see my screen?
I
Can you
can
see my
see only
screen?
half of it.
Or really? Mm.
A little bigger.
Yeah, 1 second, 1 second,
Yeah.
1 second. I'm just coming to that. Is it okay now?
Yes, thank you.
Thank you. Thank you so much. Thank you. Thank you, everyone. I've been hearing to various speakers over the last half an hour. It's in fact my pleasure to share what Women in Nephrology India has been doing. But before going to the activities as such, what we had done over the last 2 years, let me take you through the Women in Nephrology India, which is like a very naive organization which has formed in the year 2021. Though the inception thoughts were literally abortive attempts from the year 2012, we were successful in forming the committee and the organization in the year July 2021. And I'm proud to say there are about 350 plus women nephrology members across India, apart from the other groups which are interested in getting associated with us. We do engage in academics, advocacy events, and social media activities, which is in fact a profound presence for us. And we have started our own website, newsletter, and journal, which are going on a very high ride. And we have released about 5 issues of newsletter and 5 issues of journal too. So that's again a feather in cap for us. And apart from this, being India a huge subcontinent, we have about 9 state chapters, which are actually working every month on their own academic programs. And as has been said at the outset, we are very glad to share that we are organizing our 2nd annual conference in the month of August 2023. So these are in general our aims and a mission of Women in Nephrology India, basically focusing on the stakeholders that are involved in the kidney health services across the society, just not the medical students, but the patients and the other paramedical personnel as well. This is our team, a contingent of about 12-member team who work very hard and who have been working hard to put up the fame and name of In India on the international platform, which we think we are reasonably into a little bit of success. So this is the list of associations that we have. What I would like to draw your attention is that though we were named, we had an opportunity to participate in the World Congress Nephrology 2022 in a bigger way, and also in 2023 in a very huge way in Global Kidney Village in both the World Congresses. Apart from that, we had a very good participation on World Kidney Day 2022 and World Kidney Day 2023 as well, which I'm going to take you through in the next few slides of ours. So this is our website. Anyone interested probably can visit our website too. This is our newsletter, which is generally released quarterly. It's about 5 issues now. This is our journal again, which is again released quarterly for us. So our aim is to involve all the stakeholders, as I've been mentioning, patients in a bigger way, paramedical personnel and the doctors. So coming to 2022, this is the only slide which I made for 2022, though we had activities. I wanted to focus on 2023, though we were just less than a year old when we started this activity in 2022, but we had a week-long activity that's in fact very good of us, and a cohesive activity has been taken out by all the Win India members, starting from March 3rd, 2022 and ending on the D-Day, that is 10th March 2022. If you look at this, we have involved all the stakeholders, starting with the dietitian activity, which lasted for about 4 hours, followed the next day for the hemodialysis technicians, the postgraduates, that are the trainees, and virtual games for the patients and patients' attendants, transplant coordinator program, which was done on 7th March, and physician advocacy in association with Indian Medical Association. This was done on 8th March. Patient advocacy repeated again in association with the Kidney Warrior Foundation, 9th March, and strategies of adherence of practice patterns. This was a webinar which was done on 10th March 2022. So this slide is basically about the last year activities that we had done. So we were very proud to do about a week-long activities, in fact, which was very successful. Though all the activities were on online mode, we were in fact able to gather good number of participation, and we were very proud of it. So coming to 2023, we had a Penta activities of 2023. We started our activities on 5th March as a Sunday. So since I've said there are about various state chapters of India, we had gone ahead starting with different state chapters conducting webinars on various important aspects involving the trainees as well as the technicians. So we had started activities, if you notice, from 9 a.m. in the morning and ended at 9 p.m. in the night. So we had started with one of the state chapters in the morning, starting with the Karnataka state chapter, Telangana state chapter, Andhra Pradesh state chapter, Central Zone state chapter, and, the Tamil Nadu state chapter. So this is how we went off through the whole Sunday, and the participation, to our surprise and of course our happiness, it was huge and immense. So we could take across the message of the World Kidney Day in association with the Women in Nephrology India and IFKF across the various platforms on that particular 5th March 2023. Subsequently, on 6th March, we had a patient-related activity in the form of panel discussion. We had invited the patients. We had good number of question and answer sessions. This was basically an interactive session, which was again organized in association with the KWF. And also, as I said, we are active on social media. So if you look at the mid panel, we had a Twitter chat again organized by Win India team, Dr. Divya Bajpai. This is an association again with the Kidney Warriors Foundation, wherein we had looked at the challenges faced by the patients with kidney diseases. In fact, it was overwhelming response from the patients, kidney patients, where they had shared their ups and downs with regards to either logistics, finances, and their futuristic thinking and views about the kidney diseases. So this was one of the successful social media activity that was done by us in the form of Twitter chat on 7th March 2023. And the right-hand panel is for the trainees, where we had a quiz competition on 9th March. So on 8th March, which happened to be the D-Day, we had another activity. These are the few photographs that I'm just sharing the state chapters have done. This is from the Tamil Nadu state chapter. There were role plays and skits, which was recorded and which was aired across the India. With regards to the nephrology kidney care services that can happen during emergencies, how to prevent the emergencies and how we can manage during emergencies. This is in fact a very laudable and very applauded initiative that was done by the team of Tamil Nadu, and the participants were doctors and the technicians and the nurses, the renal nurses. So this was a very successful recording that was done by the Win India Nephrology of Tamil Nadu chapter, focusing basically on the theme of WKD 2023. Again, few photographs are the same, discussing about each event of emergency. Like, let's say a patient was stuck in floods, a patient was stuck during earthquake, a patient was stuck in an emergency, not able to reach the hospital. So all these things were enacted, trained and enacted by only the medical group. So these are all not the professionals of acting, these are the medical groups of actors. So this was very much appreciated. And of course, the other state chapters which have conducted their webinars, as you can see, Win Kerala, win Andhra Pradesh, win Central Zone, win Karnataka, and win Telangana. So this is how we had taken forward our World Kidney Day activities in the year 2023. On the D-Day, that is the 8th March, which happened to be the International Women's Day as well. So we had taken the topic of 2023 on 8th March. So we have invited the who's who had experienced natural disasters. Like from Turkey, we had Dr. Sibel, who shared their first-hand experience in managing the patients during natural disaster, and also from Nepal, Dr. Divya Singh, who is also chair of ISN, deputy chair of ISN SARP. So they have shared their experiences, how exactly, in fact, the photos that you are seeing are the figures that the photos that they have shown us. So we have learned a lot from them with respect to the theme that was depicted for the year 2023. So this is how it was on 8th March and 9th March. We had quiz for the trainees. So this is how we had the Penta Day activities. Apart from this, the members of Win India had conducted rallies, TV shows, radio shows, and medical student awareness programs. This is how it was done. It was a very widely reached TV programs, and of course the road shows and some educative sessions to the people as well, to the society as well, and little in the media too we had come. So this is how we had done, and this of course is showing our kidneys. This is again for the awareness of the MBBS students. This is how we have done, showing the location of the kidneys. So this was this thing that had come up in the year 2022. We had done it in 2023 again. So this is how we had a little tried to bring an awareness about the emphasis of the World Kidney Day. And so that's all about the World Kidney Day 2023, that we had a Penta Day activity. So in year 2024, we have few things in mind, but we also thought about few topics probably which can be of our concern, like genetic diseases focus, bone health focus, heart and kidney, drug substances and poisons and kidney health. This is another area where India is much more vulnerable to the poisons and kidney health, relevance of region in kidney health, healthy living on kidney replacement therapy, UTIs, stones are again a neglected area. So these are the areas where we thought probably we should have certain interactive sessions and webinars from Win India perspective to the either the patients or the medical graduates or the practicing primary care physicians. This is how we thought. We are yet to chart out our activity with regards to the same. So what we plan is a week-long activities again coming up in March 2024 with patient advocacy, medical student activities, rallies, quiz, webinars with the international faculty, and of course the other medical, paramedical personnel who are involved apart from the technicians, the dietitians. So these are the people whom we plan to involve in the March 2024 with certain questions and questionnaire which are depicted like this. So these are the things which we have in mind, and we are available at all these social media platforms and all our websites and Gmail as well. So thank you so much for the opportunity. I'm extremely glad that we were given a platform to share what we have been doing. Though ours is a baby organization, yet we were able to do in a more excellent way over the last 2 years. Thank you so much.
Thank you, Dr. Manjusha. Over to you, SF. Who's the next? SF, we can't hear you.
Lima, I make you host. Lima,
Dina's already presented.
Lima has
okay. Well, she sent me her present. So do you want me to share it from my side?
Yeah, I can try, Dina, to share screen, but I am not sure.
Host again. Yes,
I will try, but if I don't make that good, Dina can. Share. I am not sure that will be. No, it's better, Dina, that you make that, maybe.
Okay.
We can see you now.
Okay. You can start.
Yeah, I don't see Dina.
Yeah, I
anything.
can't see I cannot see the screen either.
I can.
Oh. You're able to see the full presentation? Ah,
Yes, I can.
Can you see it?
I'm not able to see it.
Can you?
Let me share it again.
Maybe you can get out and get in again.
You see it.
Someone else is sharing, I think.
I think Halima's is still on, so maybe she's got to stop sharing.
My presentation because I'm not sure. Okay, I will.
So because I'm able to see only Halima's screen.
Yeah, that is a problem. Dina, you can try.
Oh, can you just stop sharing your screen from above? Or SF, can you
Okay, now Dina, you could try.
okay. Can you see it now?
Yes, yes.
Okay.
You can see a screen now. Yes. Good.
My microphone, okay.
Yes, I hear you.
Yeah. Good afternoon again. Thank you for invitation. I'm glad that I today with all of you. Our celebration of World Kidney Day in Bosnia and Herzegovina, our three organizations are very strong in that. That is Society of Nephrology of Bosnia and Herzegovina, Association of Patients of Dialysis and Transplantation, and Donors Network. And last 10 years we have had a lot of activities, and we are recognized in our country by media, by social media, by press, etc. So next, Dina.
Yeah.
Next slide.
Yes.
You tried, yeah. I present only for 2022 and 2024. We always made campaign and use the material of World Kidney Day and translate, and together with Ministry of Public Health and Ministry of Health, and we have a lot of educational tribunas by non-nephrologists, by family doctors, etc. But in 2022, we always, because transplantation is at low level, we always try that beside prevention of chronic kidney, they make something about transplantation, because media follow us very strongly that during the World Kidney Day. Next, Dina. And so in 2022, in a March, Dina, you can next slide put. And all materials about World Kidney Day we translate to our languages. So that in a March, the best in Europe and in the world in transplantation came in Sarajevo, in Bosnia and Herzegovina, and we celebrate together that World Kidney Day, and it was one really imposant by media and everything follow up. Next, Dina. I emphasize that organization of patients are very strong with us, and we together, and every year they made one marathon, and last year they also made in one small city in Bosnia and Herzegovina marathon. That is some photos from that, and we also made a lot of campaign by the street in the different cities. I didn't make that now because of the short time. Next. That is some photos from that marathon from the last year. This year also that make. Next, Dina. And now that is 2023. we made one educational activities at the university next of Sarajevo, and we made one tribune always with patients and a lot of students in rectorate of university, and it was very succeed. And after that, we have always by the media fall and always about in March is a month that in Bosnia and Herzegovina a lot of media has written about that. Okay, next. That is also marathon in Vitez this year that made, and we always made promote material and share that material, t-shirt, pencil, and other things. You can see the president our association here together with other members. About 200 participants had been in that marathon. Next, Lina. And thank you for your attention. That is for who don't know, that is Bosnia and Herzegovina in the Balkan regions. We belongs to Southeastern Europe. Thank you very much.
Thank you. Very interesting. Should we move on to Robert? I make you co-host.
Yeah, I'm ready.
Then we have Bonnie. Yeah.
Okay.
I think Dina has to stop sharing.
Okay. It's okay. You see my screen?
Yes, you can see.
Okay. So I will try to be brief. How are you, everybody, today? Thank you for inviting me to participate to IFKF. So I will talk briefly about the World Kidney Day activities in Lebanon and with the LSNH, Lebanese Society of Nephrology. So a brief about Lebanese Society of Nephrology. We had the first dialysis session in Lebanon in 1959. 1968, first chronic hemodialysis center at AUB in Beirut, American University. And 71, we had many new centers of dialysis. And in 1973, establishment of Lebanese Society of Nephrology and Hypertension, registered at the Lebanese Order of Physicians. And unfortunately, we still have the war between 1975 and 1990. After that, we start our scientific activity officially in 1992, first Congress of Nephrology in Lebanon. So for 5 million inhabitants in Lebanon, we have also 1 million refugees from Syria. We have 80 hemodialysis center in 2023, around 180 nephrologists in Lebanon practicing. 30% of them are women. So we have a lot of women in nephrology. And we have around 4,000 patients on hemodialysis and around 200 people on PD, peritoneal dialysis. So we are suffering for economic crisis since 2019, as you know, and we had a big explosion in Beirut in August 2020 that destroyed many hospitals, many centers of dialysis in the capital. And since 2019, we have a lot of difficulties for supplying filters, hemodialysis filters, and chronic medication like immunosuppression for kidney transplant patients. Briefly, we start kidney transplantation in Lebanon in 1985, and till now we have around 2,000 kidney transplant in patients. So what about World Kidney Day activities in Lebanon? We start slowly since 2006, between 2006 and 2014, with a small conference, awareness conference in all different regions in Lebanon. In 2015, we start officially to have big events in Lebanon for World Kidney Day. I start to have a working group for World Kidney Day with many colleagues. And we start to distribute flyers in hospitals and malls. And we convinced the Ministry of Public Health to support us as national campaign. And they gave us the month of March as the kidney month. So we have the opportunity to make activities on all media for free. all March month, since it is the awareness month for kidney disease. So we start in 2016 with the kidney disease and children and campaigns. You had the right to have a TV clips for 30 seconds to be diffused on all national TVs for free during the month of March. And we have activities in Working Day in 80 hospitals with hemodialysis centers, stands at the entrance of the hospitals and distributing water and taking blood pressure. We go in many big malls in the capital, and we had the opportunity to send the short message via the mobile phones to 4 million persons in Lebanon for free, since it is sponsored by the Ministry of Public Health. We had the regional conferences, nurses conference day, many days we did for nurses, for renal nurses, many TV interviews, a press conference with the Minister of Public Health, and we organized many marathons and sport activities across the countries. Unfortunately, since 2020, 2021, we had the COVID-19 pandemic, so we suspend all the campaigns. We have some timid one on social media. This is our poster for kidney disease in children, made by one of our biggest artists in town. So this is for women and kidney disease in women. Also, this is the latest one from 2022. It was sponsored by AstraZeneca. And this is a campaign of 2022, the flyers, the posters, and we had a one-day webinar with Professor Wagner and many speakers from Lebanon, and they were diffused on social media and with a barcode to follow all the activities and all the awareness, material for awareness campaign. In 2023, we didn't do a national campaign since we didn't have any sponsor for this, and have, as you know, a big economical crisis in Lebanon. So we have only to do a small symposium. We call it Women in Nephrology Symposium, done on March 8, 2023. With the participation of Professor Agnes Fogos. She gave us a talk, online talk about COVID and kidney disease, and we have another two talks with Professor Daniel Schlerer about occupational risk and kidney, and pregnancy and CKD by Professor Najat Fares. So this is a press release done on Working Day 2023 to the media in Arabic. And as I told you, we had many TV clips we did with famous actors in Lebanon for free. They gave us their spots for free. And this is one for women in nephrology, women in kidney disease in women. It was a very nice video clip. This was the latest one. TV clip was done on 2019 about the prevention of kidney disease, and we had a lot of TV interviews in 2023, awareness for kidney disease, since we didn't have the opportunity to do a national campaign without any sponsor, and the Ministry of Public Health suspend all sponsoring for prevention during the COVID pandemic and during the economic crisis in Lebanon. So thank you for your attention, and we hope we'll do something new in 2024. I are looking for some sponsors to do a nice campaign in 2024. Thank you.
As if we can't hear you.
Thank you, Robert. It's not easy for
Thank you.
everyone around the world, but you have done a great job. I've opened to Bonnie to be the next one. Bonnie, do you want to come in?
Sorry, I don't have a material. The Carlos Castro have a emergency in the ultimate moment, and don't tell me that I need a need the presentation. Sorry.
Okay, good. Who else have not presented?
Aisha, I think.
Okay, yes. Where's I see gone missing. Oh, there you are.
No, I'm here. Hi.
Hi. Do you have a PowerPoint? Do you have it? Oh,
No, I don't have, because we had the earthquake and we literally didn't do anything counts. So we had a video. We were preparing for the disasters and crisis syndrome and kidney health, but we actually had the earthquake there. It affected 11 cities and 13 million people. And still we are trying to recover from this situation. What we did was we did shoot a video about dialysis patients and as health professionals, how to get out from the dialysis center during an earthquake and how to protect themselves. And we used some of key visuals around the city, but that it wasn't that big time thing, because people at that time, we are still having the effects of disaster. We are hoping to do a good thing for the next year. And thank you so much for the presentations you shared. They were so inspiring, and I had my notes about doing things for the next year. Thank you very much.
We understand. We understand. Adina, have in mind that maybe our next webinar, we can talk about disaster management, but when we're ready.
I think Bill Wong and Samuel and Alexander.
Samuel, can you come back in again? Samuel, can you try? Samuel,
yes, can you hear me now?
Oh, good. Sounds better.
I'm still around.
Yes.
Can you hear me now?
Yes. Do you want to show your slide, or should I show it for you?
Yes, show it.
See his slide now? Can you see it?
Yes, I can see that one. So thank you very much for giving the Malawi an opportunity to show what the world did with the World Kidney Day. On that one, we are looking at on that slide, we are looking at as Malawi, when we are trying to organize the 2023 World Kidney Day. We actually started our preparations in the 2022 November to make sure that we have actually organized ourselves to make sure that we are able to mobilize some resources. So the foundation actually requested from the well-wishers to support the function, actually financially and in kind. And for us to get organized, we actually had about 3 committees, whereby the first one was the resource mobilization, which was supposed to be looking at to mobilize resources and get the finances to make sure that we are able to run the function. And the other one was the protocol committee, and the other was the advocates to publicize the function itself so that people should actually understand why we are looking at it in the work in the day. Now, during the mobilization, we actually only mobilized the $3,386 against our budget of $5,300. And on that website and on that screen, you can see those that actually helped us to get the funds. Now, before the actual date of the function, that was the main event that was going to happen, we had a number of activities, whereby the first one was a panel discussion which was actually aired on the TV and on the radio. And we also had some various programs on the radios, and we had the press release in the newspaper. And next slide, if you see on that one, it was the panel discussion. We had a panel discussion whereby we involved the medical personnel. We had a person living with a kidney problem. And in that picture, you see the presenter, and that one in the uniform is a nurse, a matron at one of the dialysis units. And the other one in a black jacket is myself. That was a person living with the kidney problem. And the other slot was Dr. Fethi, whereby is the head of the renal unit, with Dr. Chiwanda, who is the head of the NCD unit at the ministry. During this particular function of the panel discussion, we allowed the general public to ask questions, because what we actually discovered is that in Malawi, there are actually a lot of challenges. People are not able to understand why we are talking of kidney problems. People don't know. So this panel discussion, we highlighted the issues of kidney failure. We highlighted the kidney diseases so that people should understand and get that in depth of the problem of kidney failure. Now, after this particular event, we had now the main event. You can go to the next slide. And the only main event is now that one we actually had now the main function which we had in Zuzu. So in that particular, we had a number of activities where we done. There was a speeches, there was a big walk, there was the radio and the TV interviews. We had traditional dances, we had music composed by people. And can you just go back to the previous go back to the previous slide, whereby next, yeah, that one. If you see in that particular picture, you find out that that was the guest of honor, who was the chief of that particular area. We involved the communities because we understood that there are people within their communities. So that was the chief making the presentation, in whereby he actually highlighted that there is a need for the government to install a dialysis unit in the northern region. And he also actually appreciated that the foundation has brought the issue of World Kidney Day in the northern region of Malawi, whereby the cases of issues of renal failure is increasing, but there is no dialysis unit in that particular region. So the chief actually recommended us that we made a very good choice to have the World Kidney Day in that particular region. You can go to the next slide. Yeah, the next slide, you see that there is Dr. John Chipolongwe. He's the one heading the renal department at Zuzu Central Hospital, whereby there is no dialysis unit, but they are able to detect, they are able to recognize, they are able to treat people. So that one also expressed the concern of the general public there that there is a need for dialysis unit in the northern region. You go to the next slide. That was now part of the cross-section of the big walk, because on the actual event, we had a big walk whereby we walked through the town, we walked through into the communities to amplify the message, to make sure that those who do not actually come to the main function on the ground, but they should be able to get the information. They should be able to understand what we are talking of kidneys, what we are talking of kidney failure, what are we talking about when we talk of kidney stones. So the general public actually appreciated what we did. And during this particular big walk, the chief also participated in that one. And there were a number of government officials who were in participation in that particular big walk. And we managed to engage the crowd again to make sure that we amplify the issues of kidney failures. Next slide. And with this World Kidney Day 2023, there are a number of successes that we actually recorded as Kidney Foundation Malawi. Before and during the main event, we were able to achieve a number of planned activities, whereby during the panel discussion, the foundation made a very good impact by giving the awareness to the general public, because even after the panel discussion, after a week or so, we were able to get the feedback. People were still calling us on the phones to ask us what they need to do, how they can prevent it, and the like. At the same time, the partnership with other stakeholders like the government and the CSOs, it actually increased our relationship in the networking as a foundation. We managed to print the T-shirt, so the printing of the T-shirt also amplified the visibility of the foundation, because even after the function, after World Kidney Day, the t-shirts are still being weared, and the message is there on the t-shirt. So we are still giving out the message, we are still giving out the awareness. And the choice of the venue in the northern region amplified what World Kidney Day is about, what the Kidney Foundation is all about. And the next slide will talk of the challenges that we faced during the World Kidney Day. Actually, we found the foundation had a number of challenges, as it was difficult to raise the funds to meet the budget. As a result, we actually reduced our budget to $2,300 against the budget of $5,300 because of our economy challenges that we are facing in Malawi. And the next one is because the parliament was in session by that particular time, because our aim was to have the Minister of Health as our guest of honor. But because the parliament was in session, the minister failed to attend. That's why we turned the guest of honor to be the chief of that particular area. And our friends from the Blantyre area, which is the southern region, also failed because they needed to cover about 800 kilometers to attend the function. And as a foundation, we also failed to print the flyers because of lack of funding. The next slide is now what we're looking at for 2024 World Kidney Day. This one, the foundation is considering to change the region or the function, the central region, and we are proposing the Salima district or G district, where we have recorded that there is an increase in the kidney failure patient in those areas. So we're trying to do that in those areas because we feel there is an impact. We are looking at the budget. We are looking at engaging maybe the international partners, and I'm happy today I've managed to link up with a number of foundations in different countries. So we are looking at having the international partners who could actually support us on the proposed budget. And this time, we're trying to consider that we should invite the vice president or the second lady as the guest of honor, because the minister becomes very busy during those particular time, March, whereby the parliament is also in a session. So we feel that the vice president could be also available. And the fact that if we invite the vice president, it will be happy. We'll be happy because it might increase the crowd. And because of the increase in the prices of commodities, we are trying to think of increasing the budget to $10,000. And the foundation is trying to print some brochures and flyers to make sure that we are able to have a number of actually events. And when you look at the pictures, our functions were actually attended by various stakeholders, like those in the white. Those are the nurses from Zuzu Central Hospital who actually attended the function. And the other one, there is myself in a maroon golf shirt and my friends, whereby we also patronize the function. And that one, you will see people standing up. Those are members of the Kidney Foundation Malawi. Some of them are patients, some are the nurses at the dialysis unit. And the other one is the cross section of the participants who actually attended the function. And the last one you see, that is World Kidney Day. That was myself doing the panel discussion at the radio station. Otherwise, thank you very much for your listening. We are there to participate, and we are partners of World Kidney Day. Thank you very much. Thank you.
Well, very interesting to hear from you. The thing is left with Italy. Alessandro, do you want to say something? Do you have your slide or?
Yes. I don't have slide because I told you
Okay.
I was worried about the connection. But
I put some of your slide.
Yes, all our slides are visible in the Connect magazine. And most of our today's presentation are even visible on the Connect magazine. So if you can show me the slides about Italy, I can say 2 words about it. If you go to, okay, yes, exactly. That's the most important. Of course, you can see what is our activity. the bulk, the core was the open doors in nephrology, 78 events. I mean, in mostly 80 nephrology units in Italy. There were blood pressure measurement, urine examinations, and clinical visits. And then at the end, if there was something wrong, they were addressed to the nephrology specialist. We have also, since many years, we go to make a sensibilization in the schools, mostly in the last year of high school. Then you can see the lit monuments after you will see that we unlighted some very important monuments in Italy, the activity in the square, and so on. Can we move also? We take care about a homeless center, as it was reported by someone before. I don't know, maybe Dina probably. And this is a summary of what we have done exactly in the different units and different squares, consultations, visit, and so on. Let's go. This is the unlighted, most of our important. This is the Mole Antonelliana in Turin. This is the Royal Palace in Caserta in Italy, one of the most famous in the world. This is the square in Piazza Manucci in Perugia. So you have it everywhere. We unlight the monuments. Let me see if you have something more.
No, that's all I got.
Okay. Anyway, now we are planning an archeo walk. I mean, a fit walk in September in Roma, along some Roman ruins. Of course, Roma is full of old ruins. During the aqueduct park, the old aqueduct in Roma, and then people from dialysis patients, nurses, doctors, parents, transplanted people, kidney patients in general, they will all participated to a short fit walk along these ruins. It will happen on the Sunday, the 24th of September. I already sent to Kausi the program and the flyer about this. And what else to say? Well, we continue our activity everywhere, and the foundation strictly collaborates with the Italian Nephrology Society, the scientific society. So things are going well. But I can make a call for all of us to try to enroll. That's good what Dina has done, but to enroll also other foundations that we lost in time. I think about the French one, who has been for a long time member of the IFKF. This is the first time I think about, and also some in UK. There was a kidney research for UK, with which we collaborated some years ago. We made also a poll between the difference in kidney transplant perception between Italian and British patients. So I think we must again, this is my invitation, again try to recall these foundations to enter again and to collaborate with the IFKF. Okay.
Thank you very much. I'm mindful of the time. I think it remains for Hong Kong to make a short presentation. As I mentioned, I actually came up with the first Hong Kong Kidney Day. That was 2001. That was a long time ago. That was a very young me, 20 years ago. And then we had the first World Kidney Day in 2006. We have many events, very interesting, a lot of fun. We really enjoy it. But this year, the World Kidney Day in Hong Kong, we actually took a different angle to the unexpected event. We didn't talk about disaster because I think Hong Kong is quite well prepared for all type of disaster like COVID and other things. So we focus on the disaster of an individual that people did not know that they got disease, what we call research for the invisible unexpected patients. What I would like to share with you is that we have a very good collaboration between kidney foundations nephrology, and most important, the renal nurses. They got a very strong renal nurse association, and also with our patient partners as well. So I think those are something which I want to enlighten on, is that we need to work together. It's not just one party. So our campaign is, this is in Chinese, but what it say is, are you one of the people who don't know you got hypertension or diabetes or high cholesterol level or high body weight that you're not aware of? If you think this is okay just to be a bit higher, it's not. And we're going to search you out so that you know you got a problem. And that's what we did. The whole first of this search on people who do not know. I'll tell you why in a minute. So what we did is, for a few weeks before the World Kidney Day, we went to the health center, 5 health center. We set up booth, and we do blood tests for them, finger tests, which we can test for cholesterol and blood sugar, and actually make a screening test whether they got diabetes, high sugar, or high cholesterol, and body weight and blood pressure as well. I'll show you some data. It was very popular. The elderly people just love it. They just come down and have all the tests. It was very labor intensive because we work with a lot of doctors and nurses. And then we also have a carnival on the Sunday before World Kidney Day, when we have a major event, when we have people gathering in a place where we celebrate World Kidney Day. Now, this is the World Kidney Day. We got the Minister of Health there, and you can see that we got all the major people from Hong Kong attending, from healthcare professional and the patients. And our main thing was, we're going to find you, because we know that there's a lot of people who do not know they got diabetes, hypertension. I'll show you why in a minute. On the health screen tests we done at the shopping center, we test 1,600 odd people just randomly. They're elderly patients. That's why the percentage is so high. And they tell us 30% of them told them they know they got high blood pressure, high cholesterol, and history of blood sugar. But what surprised us was, when we actually test, we find 56% of the patients do not know they got hypertension. 50% of patients do not know the blood sugar is high. 70% of the patients do not know that blood cholesterol is high. 36% of patients did not think that their body weight is high. So this is a message we want to get out. A lot of people are undiagnosed. And even those diagnosed, even those who know they got disease, look at that. Half of them, their blood pressure is not controlled, their blood sugar is not controlled, their body weight is not controlled. That's the second message we want to say, is that a lot of people do not know they got a disease, and a lot of people, they know they got disease, but they're not well controlled. Well, we got doctors and nurses do a drama highlighting that don't just think a blood pressure 150 is okay. It's not okay. Blood sugar of 10 is not okay. So that's the message. So we did a role play there. I think the 8 golden rules is good. Everyone around the world is talking about that. We focus on drink water, don't smoke, and all these other things as well. We promote exercise because we want to prevent diabetes as main cause of end-stage kidney failure. To do that, we don't want people to be overweight, obesity, so we promote exercise. We promote exercise in the sense that walking is a very good thing to do. 10,000 steps a day will keep the doctors away. And the doctors saying for the patients, and also we got fantastic support from the pharmaceutical companies who really support. They all wear the t-shirts on the same day and took a photo. And we have newspaper on all newspaper, 5 new newspaper on the World Kidney Day full page, so everyone know that what's going on. And we also have a lot of online radio programs, and we talk to people on the air. And so we also, the other thing we find very useful is that we place a full page advertisement board on the underground. And I have so many people ring me out. I saw you, Dr. Lui, is that you? So that's very interesting. And that's how we actually get them to notice it. And we also have buses that carry our logo as well. So those are some of the things that we did. And we also, like you, I will also have a 30-second clips on the television by the government, which rolled for almost 3 months non-stop, almost every night. So those are ways that we think we can promote kidney health for everyone. So that's my brief sharing for Hong Kong. We had a lot of fun. My main message is work with the nurses, work with the doctors, work together, and with the patient as well. And that's what we did last year.
Would Bill Wong also like to say a few words? Bill, would you
Sure.
like to?
Well, Dr. Lui put Hong Kong's activities more elegantly than myself. But from patients' perspective, I hope that the kidney foundations stay true to themselves, stay relevant to patients. Patients are really the core of your concern. And as a new chairman of the patient group under ISN, I will be able to set agenda. I hope to work with as many as possible of you for the welfare of kidney patients in the coming years.
So we hope to get more kidney patient groups in our fold. So do help us and connect us, and all our organizations should be able to do that. Asif, do you want to say a few words?
Maybe just for the last 5 minutes, I just like to give every one of you a head start on what is coming next year. We've been working on the theme for 2 to 4, and you have not heard yet, but I can let you know, it's no secret because we're working on it. Next year, we're focusing on medications, okay? So you can work with a lot of people. The title is Kidney Health for All, Advancing Equitable Access to Care, in particularly how to optimize medication. Now, the 5 of us on the Joint Steering Committee have fought so hard to get this on the agenda because ISN have a different agenda. They want to talk about equity and equity and things like that. But we thought our foundation are more grassroots. We want to get richer people. So let me just share with you some of the thought that why I fought so hard for making medication as a theme for next year. I'm sure all of you agree medication is the most important element in the prevention and also the management of kidney disease and failure. Of course, after lifestyle adjustment. Those of us who are doctors know that we're not using the drugs optimally. Patients should be treated, they're not treated, they're not optimized the target, they're not using the renal protective drugs, which are expensive, but they're now coming on, and a lot of patients are not treated properly. If you ask the patient, they're just on too many drugs. All the patient told me, doctor, please don't give me so many drugs. I cannot take all of them. We need to focus on drug reconciliation and polypharmacy. A few years ago, we talked about health literacy. I think we need to talk about drugs as a health literacy. Patients don't know what drug they are on, why they are on, and how to take it. I think we need to educate patients. Because they don't know it, so therefore they're not very good for drug compliance. These are all angles that all of you can work on next year. My personal interest is medication safety. Medication kills a lot of people. Okay, we need to be more safe in how we use it. And then finally, I think it's an issue. Is the drugs are not affordable in many parts of the world. I think we need to do advocacy to make drugs cheaper and available to everyone. So that's the main theme for next year. There's so many different angles. How to effectively use the drugs. I'll share the PowerPoint with you. There'll be more coming up from the Joint Steering Committee later. There'll be an editorial, but you won't see that until March. But those are things that you can talk about. How to prevent kidney disease, how to slow down kidney disease, how to use drugs to treat kidney disease, how to manage the symptom better, how to manage your medications. And safe use of medication is a real problem. Some of you may not realize it. Medication kills so many people that WHO last year actually named World Patient Safety Day, saying that unsafe medication kill more people than anything else. I think we can spend a lot more time on that. And to me, just give you some thought on it. I think we can have conversation with patients. We want to engage a patient. Do you know what pills are on? Do you know why you're on them? Do you know how to take them? You certainly encourage them to say, can I talk to doctors and say which pill I need? So that all these are health literacy. I think the healthcare professional can talk about how to optimize the medications, how to save use of medication, and the healthcare system, we can talk about how to make drugs more available to everyone. So just give you a head start on what is coming next year. So we're very excited about the topic. Medication is so important. It is something that we should focus on. So just give you a head start on thinking about how you want to plan the World Kidney next year. Okay, that's about all I need to say. So back to you, Laf.
Thank you, Asif, for pulling us all together and organizing this wonderful Zoom meeting. Here, I'd like to welcome, I think, the father of IFKF WKA and the person who mooted the World Kidney Day, Professor Koppel, is here with us. Maybe you would like to say a couple of words. Thank you for joining us. We have taped this whole thing. There's been such a wonderful session with all our members sharing their World Kidney Day activities and their future thoughts. So, Professor Koppel, would you like to say a couple of words to us before we close?
Thank you, Latha. Well, I fully agree with SF's perception of the importance of a focus on medicinal intake, and with all of the attendant issues that he described. I think, as usual, he's right on. I think this could be a very, very valuable World Kidney Day. Thank you, SF. It's nice to see everybody.
Yes, nice to see you, Joe. It's early morning for you.
Yes, so thank you all for joining us. IFKF WKA will have to expand. We need to bring more people into our fold. And we also want all members to bring in one member at least, so that we can, grow, especially in the next year or so. And as Alessandro said, we need to get more of our older members back into the fold. Another thing is, any videos and presentations that you'd like to go on our social media, please send it to Kausi at info@ifkf.org, so that we can also spread the message about our members. It'll go on our website, on our social media handles. So we request all our members to make use of that, so that more and more people will know about each organization, the activities that are involved in, and everything. So I just want to say grateful thanks to all of you for being part of this program. I think it'll be an eye-opener. I have learned so many things from each and every one of your presentations. So grateful for that. SF, thank you for organizing this. And our next webinar is coming up. Kausi will just tell you a little about it.
Yeah, that is, the date is not yet fixed, but it will be towards the end of August. It will be based on food and the importance of diet for kidney patients. So that's the general idea of doing the next webinar on food.
So next one will be a webinar with 4 speakers, and we want everyone to participate. Dina, I think you have a couple of words to say.
Yes, while I was preparing this presentation, I found some pictures that I just wanted to share with you. You just give me 1 minute for some memories, some old, very old memories with the IFKF. This was in 2008 in the mines, and this is Professor Kuppel, where we were discussing my poster. And there is Timur and Professor Kuppel, and that was me. I think I've changed a lot, and this was in 2008. I changed a lot since then. This was the group photo that we had at that time. And this was in Istanbul in 2010. This was group photo in Lyon. This was in Malta. This was in Lyon too. In Malta, and Aisha here is in the picture too. And this is in the WCN. So I hope that we will gather again soon, and we can all meet in person and have our pictures for the coming future. Thank you. Just wanted to share those memories with you all.
So all going well, we're going to have many more memories in the future now that COVID's out of the way. So let's plan on, meeting up and having a face-to-face meeting soon. We are talking about it. Dina, I think you are going to be the prime mover. And since there are lots of memories that we're sharing today, we've all had some lovely times in the IFKF WKA annual meetings. So let's try to see what we can do and how we can get everybody together again.
Yes.
If not, then Zoom is always there. Okay.
Yes.
So, but anyway, we'd love to have a hybrid program. SF, do you want to close?
Yes, if I may do so. I actually got quite a few more presentations from those who cannot join us tonight. And I asked all the speakers tonight to send me your presentation. I'll put together a special brochure on the activities. It's so interesting. We've got so many good activities that we can share among ourselves. So I'll put together a special issue of World Kidney IFKF Connect just based on the World Kidney Day activities. That would be good.
So thank you. Please send in your presentations at the earliest so that SF can work on it. You can send it to info@ifkf.org with a copy to SF as well. So we look forward to more meetings like this. Thank you all for joining us. And next time, I'm sure there'll be more members who will participate. We will try to adjust the timing also accordingly. So thank you. Good night.
Thank you.
Good morning.
Everyone.
And good evening.
Thank you.
It was lovely to have
Bye.
all of you. Thank
Good evening.
you.
Bye-bye.
Bye-bye. Bye. Thank you.